Hi EJ, my name's Caitlin and this is Sierra. We're going to be your nurses for today.
Hello.
So I've heard you had a few complaints that you wanted to bring up to the doctor. What would they be?
Lately I've been pretty shaky and sometimes I have trouble walking.
Are there any other problems? Maybe you noticed that you're a little weaker than normal or even some problems with your speech?
Now that you mention it, I've definitely found myself struggling with coordination and I'm weaker than normal. Maybe I've been having some problems with speech too.
Okay, well we're going to go talk to the doctor and we'll be right back.
Sounds good.
Hi Eric, my name is Aaron. I'm going to be your doctor today. So based on some of the symptoms that you've been describing to us, as well as your previous doctor's visits, we've come to the conclusion that you have Parkinson's disease. Parkinson's is a neurologic disorder due to a decreased level of dopamine in the brain that will affect you for the rest of your life.
Most of the time it happens to people that are in their 60s, but it can happen to anyone.
So what do we do to cure it?
Unfortunately, Parkinson's is not something that can be cured, but there are a lot of drugs that can be used to slow the effects like you're having, such as tremors, weakness, speech problems, and walking problems, and more.
So what we're going to do is start you on dopaminergic drugs, specifically Sinemet, which is levodopa and carbidopa combination, to increase your dopamine levels. This will even out the balance of dopamine and acetylcholine and make it easier for you to function by relieving the symptoms of your Parkinson's disease.
Because you don't have angle closure glaucoma or any GI obstructions or allergies to this medication, it's safe for you to use. If in the future you experience peptic ulcers, urinary tract obstructions, or are diagnosed with bronchial asthma, cardiovascular disease, or psychiatric disorder, you can most likely keep taking the drug. We'll just have to monitor with caution.
Aside from helping my Parkinson's, what can this drug do for me?
With the dopaminergic Sinemet, you can have some side effects like arrhythmias, headaches, blurred vision. You could also feel more anxiety or nervousness when you take this drug.
So keep in mind, while you're taking this drug, you should not take any MAOIs for depression or any vitamin B6 because you could have toxic side effects. So I know it's a lot of information for you to take in. So do you think you understand all this information?
It's young Dopa on the track. I'm about to go in. Haha. I've always wanted to say that. But let's go. I went to the doctor cause I couldn't stop shaking. I asked them what was wrong and they turned and said, "Well, you had Parkinson's, I'll take this med. It's called levodopa and it's really dope." No pun intended. I hope you're not offended. I responded, "Oh my," and then I just sighed. She said, "Don't sigh until you give it a try. When given with carbidopa, it's called Sinemet. It crosses the blood-brain barrier, but don't you fret, cause it's converted to dopamine, which makes it better yet. You gotta keep in mind that this is not a cure, but it will make you feel better, and that is for sure. And if you have more questions, please read this brochure. Dope. All I want is dope, dope, dope. All I need is dope, dope, dope. Cause it's a lack of dope that's causing all these tremors. Dope. All I want is dope, dope, dope. All I need is dope, dope, dope. Cause it's a lack of dope that's causing all these tremors. I said, hold up, wait a minute. I'm not even finished. How many do I take and when will they diminish? Take it by mouth 3 times a day. 6 to 1.5 milligrams and you should be okay. Taking it on an empty stomach may cause some nausea. Take it with food and there will be no drama. I know all this is pretty alarming, but please call the doctor if your stools are retarded due to drowsiness. Driving is off limits. Just obey this rule, you could end up in a ditch. When taking Sinemet, I should also mention, avoid MAOIs for risk of hypertension. Dope. All I want is dope, dope, dope. All I need is dope, dope, dope. Cause it's a lack of dope that's causing all these tremors. Dope. All I want is dope, dope, dope. All I need is dope, dope, dope. Cause it's a lack of dope that's causing all these tremors. I hope you learned something from this song. If not taken correctly, things could go wrong. That's how you take this life-saving medication. So please spread the word through this hip-hop education. I'm out.
Okay, Eric, so it sounds like you have a pretty solid understanding of this drug. Call us if you have any problems or questions.